Hi, my name is Paul Sexton. I'm the new CEO for Hibiscus Children's Center, and I'm excited about an opportunity to share some of the things we do at Hibiscus Children's Center. As I mentioned, I'm new to the Treasure Coast area and Hibiscus Children's Center. I come here from Colorado, and I have a strong background in community mental health. And I think that's particularly helpful since Hibiscus Children's Center has a strong mental health component. Today I've asked two of our staff members to join me as we talk about what we do for children in the Treasure Coast. The first is Caroline Beal. She's the director of our Mental Health Services program. And I have Nicole McGarry, who is also has a strong background in mental health here. So Caroline, can you help our audience understand some of the mental health challenges that our children come to as we're trying to serve them?
Well, Paul, we see children come into Hibiscus through our shelter or our village. So they're coming into our residential programs because they've been removed from their home. So therefore they've experienced some sort of trauma. Just being removed from their home is considered a trauma. When we talk about trauma, we see simple traumas or complex. So a lot of the children that we see come into our care have experienced complex trauma, which means that they've been exposed to trauma over time. So it's chronic stress that they've been exposed to. So what we do, actually Nicole is basically the first responder. She sees the children within 72 hours of coming into care, and she assesses them and makes the diagnosis and gives recommendations for their treatment. So after that, we assign them to a therapist who is specialized and trained to treat the trauma that we're seeing in our children coming through our doors.
Great. So can you give us a better example of what trauma might look like? I think the average citizen, when they think about children coming to Hibiscus Children's Center, they're thinking about children who don't have a place to stay, so we're giving them shelter, and we're making sure they're in a nonviolent atmosphere. But what kind of trauma are they experiencing? You're using terms like complex trauma, but give us an example of what trauma really looks like to a child that comes to our center.
What it really looks like is being a child and being exposed to domestic violence. Watching your parents or maybe it's your mom and their significant other constantly fighting, hitting each other, being exposed to substance abuse, drinking, being exposed to a parent that has mental illness. So it's complex because it's that interpersonal relationship they have with their parent that has been estranged and conflicted and unpredictable to them, being that that's supposed to be their caregiver. So they can't rely on them. And then one day they're at school or they're even at home, and DCF may come in and the sheriff's department, and they tell them that they're being removed from their home or they're being taken out of school. Then they're being placed in some unfamiliar home or emergency shelter like ours, and they don't understand what's going on, and they might think it's their fault. So that's why it's complex. It's to them it's many different traumatic events that leads them to maybe become withdrawn or depressed, sad, sometimes suicidal, and then we see anger outbursts and just dysregulated behavior where they're just ambivalent about their surroundings.
Well, that's interesting to hear. Nicole, when we take that kind of snapshot of what abuse means to a child, what does it take for us to have staff members qualified to treat those children? Do we have specific training that they go through?
Yes, every staff member has a specific training. We have a trauma training that they complete. Our therapists are trained in trauma. So that, basically it's just there to support the child. Just monitor, make sure the behaviors or what we're seeing we can control. Like Caroline said, sometimes we don't see the behaviors for a while because they're so traumatized. Other times, they're happy that they're there. They're happy to have food.
Yeah.
So it is kind of,
Yeah, it's different for each child, you know, how they react and how they respond to the trauma that they've experienced, and how it manifests in their behavior. So that's what Nicole does, is she assesses them and kind of sees what the, you know, the presentation of the symptoms and what we need to do to treat them effectively. And it might not just be one person that's helping them. You know, we might be referring to outside agencies to be a part of their treatment plan.
So when children come in and they're behaving a certain way, you've mentioned that they're withdrawn or they're acting out. It would be easy for someone like me or a normal citizen in the community who might see a child acting out to simply say, here's a child with a behavior problem. They're not well disciplined. But that's not really the case with us, is it? Trauma-informed care is a program that you're responsible for, that helps us identify those triggers, those behaviors that really talk about something far deeper in that child's experience.
Right. I mean, as professionals in the mental health field, we feel it is necessary to educate the community on trauma-informed care, and what that means, that maybe even the child's behavior in the school is seen as just bad behavior, but we're trying to inform the community about their behavior as a symptom of the trauma they've experienced, and that we on the back end are trying to treat that trauma and not re-traumatize them in the systems that they're in by maybe reacting to their behavior in such a negative way. So trying to be trauma informed, a bit more sensitive, and having even just teachers and other professionals being able to handle those behaviors, you know, as much as they can, to not re-traumatize them.
You've talked a little bit about levels of trauma, and Nicole, I know you're seeing children every single day, some that are in our center and some that are in our community. Can you talk a little bit about how we interact with children that aren't necessarily in our shelter but come from the community, and we're trying to provide a service for those kids who might not reach the level of care required for them to be in a shelter, but they still need our services?
yes, through our community mental health program, we provide services in the home or in school for identified clients who may have anger issues, who may have some, you know, sadness, a lot of separation from parental separation. So we do provide those services in the community as well.
And Caroline, again, when I talk about the number of children that come to us, we've talked a little bit about the physical abuse and some of the hidden scars of abuse that a child may present with. But there's the more serious side of child abuse that is on the far right side, or extended side of that continuum. Can you tell us a little bit more about those more serious types of abuses?
Hibiscus has the only sexual abuse treatment program on the Treasure Coast. So when we talk about more egregious abuse, we see sexual abuse. So we have a program that provides that specialized treatment to the victims of sexual abuse, but also their siblings and the non-offending caregivers. So it's a very important program because sexual abuse, if left untreated, it really manifests into adulthood. And we see people that go into substance abuse, they're more likely to be an intravenous drug user. Suicide rates go up, obviously poverty rates. So the children that we treat in that program and their families, we really start that healing process and talk about safety planning and healthy boundaries, sexual boundaries, sex education, coping skills. So we really, that program is one of our specialized programs with Hibiscus. So it's very important.
Okay, and so I think our viewers, it's important for them to know that we're not just providing shelter in non-violent settings, but we've got very specific programs tailored to treat children who have some, what I would phrase as maybe minor or less serious of physical abuse or emotional abuse, but it goes all the way to that very, very serious side of the continuum where there's sexual abuse that they're exposed to, and that we've got a program that treats it. Now, we serve a wide variety of communities. We're serving 4 counties here, and so I'm really proud to be part of a company that is serving the whole Treasure Coast. But most of our patients or kids are coming from St. Lucie County. Is that right?
Correct. 57% of our clients are in St. Lucie County. So we get a large percentage of our referrals just from St. Lucie County, just from the community. Our schools, the Sheriff's Department, doctors, even our Supporting Families in Crisis program, they make referrals to us as well. So that's a primary prevention program. So when they see a family that needs services, they are able to refer to us, and we're helping the family as a whole, not just for preventative stuff, but also in intervention.
Well, I think that's good for our audience to know. When I think about what Hibiscus Children's Center does for children, specifically to shelter them, we're providing much needed mental health care for them, but we're not alone in this. Can you tell us a little bit about who we're partnering with and what that collaboration looks like? Because while you are trained mental health professionals, we also have a larger community mental health infrastructure behind us. And so I would like our audience to understand how we're interacting with the mental health community.
Okay, yes, we partner with a lot of different agencies on the Treasure Coast and different community partners. We partner with the Sexual Assault Response Team, also New Horizons, the Center for Emotional Behavioral Health, Sequel. We have Helping People Succeed, Suncoast, and so we have that partnership with each agency, so we're not duplicating services. And maybe we've had clients that had services at a different agencies, and we can kind of communicate about their treatment in the past and how to provide that continuity of care for those clients.
Nicole, can you give me just your personal overview of the importance of mental health as it relates to taking care of children? When we think about why children come to us, they're coming to us because there's either been some level of child abuse in the family, there's some level of substance abuse going on, and then there's a mental health component that really, if you took a look at those 3 components, by and large, that's what's driving the need for our services, for our ability to treat children who are exposed to child abuse or neglect or abandonment in some sort of form. So can you talk a little bit about that?
Well, as Caroline had mentioned, just the act of removal is a traumatic experience, and with each child it will be different. With the age, of course, how long the trauma has been going, and what the supports are. So if they don't have a good support system, they will not, be able to be successful. And it's just like stress. Everyone responds to stress differently, depending on your experience, depending on your support system. So it's just very important to have those components and that support with them through our programs. Also, we mentioned about the shelter in the village. When they do return home, we are able to provide services in the home as well. So that's why community is very important. We do have some therapists working in the shelter with the children, and then they will continue to work with them in the community.
So as they go back out in the community to work with families to ensure that that treatment that they received at the shelter, or in some cases the village, so that it sticks.
Yes.
And what does that look like when a therapist goes into the home to help that family have a successful reunification of their children in the home? What does that look like? What kind of services are they providing there?
Well, they're providing individual services as well as the family services. And as I had mentioned, many of them are already working with the children in the shelter. So they've already developed that relationship with them, and will continue with that relationship as they are reunified or return to relative placement.
So are these parenting skills? Are they life skills? And can you give an example? Because those terms, we understand them very, very well, but someone hears parenting skills or life skills and they don't quite understand, well, what exactly your tools are you giving that?
Well,
that
with the family, it's parenting skills. Yes, we do have an infant mental health program as well, and that focuses mostly on with parents with their parenting skills and how to deal with the younger children. So,
Yeah, it also addresses the attachment to the parent and the bonding, especially if the child was removed at first, and we did help with the reunification process. So we are trying to strengthen that bond back with the parent and the attachment, the parenting piece, and just overall improve their relationship, but also reconcile the past, you know, and try to move forward. You know, that happened, but this is where we are now, and try to strengthen the family through family therapy, individual therapy with the child still, but also with those community partners and resources too.
Well, that's, like I said, coming from Colorado and enjoying the warm, balmy weather of Florida, it's certainly a pleasure to be here, but we have challenges here, just like any other state, when it comes to child abuse and child neglect. And the good news is Hibiscus has a solution for that, and I'm really happy that we've got trained professionals like you helping us give a much-needed service to this community. What would you tell our audience about the importance of mental health in general? Is it something we should continue to do as part of Hibiscus Children's Center, or should it be segmented to just the community mental health agencies in town? Why should we continue to do it?
Well, I mean, to me, being a mental health counselor, I think about it every day. It's everything to me. But to the lay person, or just to a regular person, maybe it's something that they don't think about. But it's so important because it really affects your overall health. So if you have something going on, like you've been exposed to a traumatic incident, or you've lost a loved one, or you're experiencing stress, or there's an adjustment in your life, or even to the severe mental illness, you know, there's a percentage of the population that has a severe mental illness, and it's left untreated and left undiagnosed. So it's important to recognize what mental health is and how important it is to everyone, because it affects your overall health, and there is such a stigma attached to it these days. But to the mental health professionals, when you do seek treatment, it's probably the best thing that you could do, just because these people are not judgmental. They're there to help you, and it's okay to ask for help. If you are dealing with something that's overwhelming and it's affecting you, it's okay to ask for help, and you can get help, and healing happens. You know, it can happen, and so, yeah, that's why I think it's important.
Well, I couldn't agree with you more. As I settle into my role here, getting comfortable with Hibiscus Children's Center and our wonderful staff, what's become very, very clear to me is we're not just in the business of sheltering children. We're in the business of providing hope. We're here to give hope to a child who's been told most of their life that there is no hope, that they don't have opportunities outside of the reality they're experiencing. And so I think it's critically important that our mental health professionals help convey that message to our children, and especially the parents or the caregiver that those children are interacting with, that there is hope to be seen is an important message that our kids are hearing from our mental health professionals.
Definitely.
So, Nicole, tell us more about some of the community-based things that we're doing. I think I know you've touched on it, but I'd really like to know, more about what we're doing in that arena.
Well, I'd like to share a success story.
Oh, that's great.
Okay. We had a young lady who came to us at the village last year. Her family was she was in a conflict with her mother, her brothers, everyone. It was just a very hostile environment. She was Baker acted, which meant she was hospitalized because she was running around the house with a knife after her brother. Her mother refused to pick her up from the Baker Act, and therefore the court became involved.
So let me just stop you right there.
Okay.
So the Baker Act is a term that we use, and so we know what that means.
Yes.
In
But
Florida.
Baker Act means that the child is mandatorily placed on an observation period where we protect them. Is that correct?
Yes, she's hospitalized.
Okay.
Because of the threat of harm to others. Is it to yourself or to others?
Okay, great.
She was hospitalized. As again, I said, her mother refused to pick her up. The courts became involved, and she was part of DCF. She had been to several placements. They disrupted because of her aggressive behavior, her verbal threats. She came to us last year, and she was failing in school. Just was
A lot
not.
of anger outbursts, a lot of anger, there's a lot of anger, a lot of trauma she experienced.
Yeah. She was diagnosed by our psychiatrist and placed on medication, which had calmed her down a little bit. She was failing in school, so the school assessed her and they put her in a proper setting. And we worked very diligently on individual sessions with her anger, with family sessions with her mom, and trying to build that communication again. And I'm happy to say last month she was finally reunified with her family, and she made honor roll. So
Yeah.
we were hoping, we were just very thrilled to see that, and we hope for the best for her.
Well, that's a great
So
success story. And we're hearing those really every week. We're hearing some level of success. In your description of that success story, you highlighted that we have a psychiatrist that comes on board. So as I think about the level of care that we can provide, it starts by that assessment, and then there's a clinical professional involved, and there's a treatment plan that's implemented for that specific child. But it included seeing that psychiatrist. So can you talk just about a child coming into our system, what that assessment period looks like, how the decision is made to get to a clinical professional like yourselves, when is a decision made to get a psychiatrist involved? Walk us through that process for the listener today.
Well, once the assessment is done, during that assessment, they would be looking for any previous psychiatric history or any indicators that they may need a psychiatric assessment to determine the need for medication based on their diagnosis. Then they would be referred to our psychiatrist, and an appointment would be made. We usually do not have a waiting list for him to see the clients. He is in our Fort Pierce Community Outreach Programs office twice a month. So his name is Dr. Prado. He is one of the top-rated child psychiatrists on the Treasure Coast, and he works at different agencies as well. So at that time, he would do a psychiatric evaluation to determine if medication is needed. And then he would prescribe the medication after that. But I would say most times medication isn't prescribed. There's an evaluation, but it's ruled out that there's medication needed most of the time.
Okay. And then after that process, there's a treatment team process. So we've got the child properly assessed, they've seen a psychiatrist, they're getting some treatment regimen that we prescribed. Some of it, not very much of it, includes psychotropic medication. But how are we following up? How do we know that we're making progress with that child throughout our program? Is there a weekly checkup? Is it a daily checkup?
Well, in our residential programs, we have monthly treatment team meetings. So we do, as Caroline had mentioned, we develop a treatment plan, and on a monthly basis, we review that progress. In the community, the treatment plan is reviewed, quarterly?
Quarterly, but every time that the client comes in, if they are on medication, there is a person we have that meets with the client and the family during the visit to assess how it's going, any side effects of the medication, and how treatment is going in general. So, the best outcome, if they are on medication, that they're also having psychotherapy. But we usually do the least intrusive method first before we go to medication. So we want to start therapy first and see if that's working, then we wouldn't prescribe medication.
Okay. If I were to ask the question of children that are in Hibiscus Children's Center. Help me understand the day in the life of that child. What is the flow of their day, and where are we interacting with them throughout that day on a mental health basis?
I think for the children in both our residential programs, their day starts with, getting up, getting ready, going to school. Throughout the day, they're at school. The therapist may see them at school just to see how they're doing and their interactions with their peers and the teachers. So there may be interventions happening at school, if there's some things going on with the child. Then they come home from school. They come back to the residential program. They get there and they have a snack. All right, they kind of hang out. They get with their staff, and then there's homework time set aside for them to do their homework. They might have some recreation time. They might go outside, and then therapy is taking place there as well. So we have therapists that are housed in the residential programs that are providing the therapy there as well. So, and then after that, it's just the daily dinner and then hygiene again. They have to take showers and get ready for bed. And at the village with the teenagers, it's kind of the same way, but they probably are a little more rebellious and do some things, have different activities, more social outings and stuff like that. But at the village, Epic Mission is a huge community partner where they, at least once a week, the children go there. They have dinner, they have different activities for them to do in like a youth camp and stuff like that. So
I think what's important about what you've said is your earlier comments about children who come to us with some level of mental challenge that we're dealing with. I don't want to call it mental illness. But there's a stigma associated with it. In the way you described how children interact on a day-to-day basis is everything about normalizing their experience. They've experienced so many traumatic things in their life. And so part of the mental health healing process is building stability, a schedule, waking up on time, brushing your teeth, eating breakfast, having manners and cleaning up after yourself after breakfast, making sure that your room is clean. All those things point to normalization, which is what we're trying to do for children at Hibiscus Children's Center. It's not just a place where we take children and warehouse them, but there's really programming that happens so that child can start to feel a sense of normalcy in their life. Is that an accurate representation?
Definitely. They definitely have a structure and a schedule, and they all know it, and they all really adapt to it, and you can walk in there on any given day, each program's, and you know what's going on. I mean, it's very peaceful. I mean, in my mind, it's just that they're kind of doing exactly what they're doing. They're just kind of being normal kids. Sometimes it's quiet, and sometimes it's a little loud, but I mean, to me, it's normal, and it's a great environment that we provide for them.
Well, I think that's an exciting thing to know, that we are bringing normal kind of surrounding a normal environment to a child's life who needs us most. Well, I think it's been an exciting time this morning just to talk about the mental health component of what we do at Hibiscus Children's Center. I hope that you have learned a lot from us as we're trying to convey to our community a couple of things. One, we're excited to be a part of this community and providing shelter and a safe environment for children who've been abused, abandoned, or neglected. We care for these children, and we can't do it without your support. We do that service by providing clinical services that help to meet the needs of children who need us most. We hope that you'll partner with us, come to learn more about Hibiscus Children's Center. One way to do that is you can call our 1-800 number. I do not have that memorized, so forgive me for looking down. That number is 1-800-403-9311. And we encourage anyone interested in learning more about Hibiscus Children's Center, please give us a call or look us up on our website. Thank you very much.